There's incredible opportunity to promote change because doing the same is not the option. I'm Pierre Poirier. I'm the paramedic chief of the Ottawa Paramedic Service. I chose to be a paramedic because I think first and foremost it was helping people, but also because it was a profession 35 odd years ago that was really young and expanding. Being chief is the rare opportunity to have a real say in direction. It's a large responsibility, but it's something I love. In early 2020, I was actually in a different role. I was the director of emergency management. You know, in terms of the leadership role or the role that I had at that point, it really was about how do we protect people? And that was really a huge challenge. First and foremost, because we didn't have the necessary equipment. So there were tough choices that had to be made. One of the first choices was because we didn't have sufficient supply of masks, the N95 masks, we were using expired masks. At the other end of the spectrum was, how do we scavenge? How do we find the masks that are appropriate? We were trying to figure out how to buy internationally, how to buy something through a broker in Europe, through a manufacturer in Southeast Asia. And those were all kind of it was a whole new world of business. And I look back and it was the right decision to use expired masks and to do everything we could to protect the people who are here to serve our community. It's an issue that's come up over the last several years in the context of not being able to provide that service to the community when you know somebody needs it. You know, we've been under duress over the last several years in our ability to provide service to the community. What's happened in the healthcare system is that the capacity of the emergency rooms is unable to meet the demand. So what happens is that the emergency department can take 10 patients and we arrive with 11. The 11th is going to wait. And that becomes an offload delay. Now, in Ottawa, there's 4 hospitals, and we'll have paramedics at each of those hospitals who have a patient with whom they have to wait. They can't transfer the care of that patient to the hospital. If we're all stuck in offload delay, we're all stuck at the hospital, there are times where we don't have a paramedic crew available to respond to that next call for service. So the paramedic who's in the hospital with the patient hears this, appreciates what that means, and then this has this moral, ethical discussion, their own personal dialogue of, because I'm here, I can't respond to that next call. The patient I'm with is not that sick, but I know there's somebody with a life-threatening injury who needs my service. It can be very difficult, you know, particularly knowing that you could possibly change outcome, but maybe restricted in whatever manner from being able to provide that service.
When the hospitals are in dire straits, then it flows to us. We get plugged up there, we can't offload our patients, and then our levels suffer, and it's a big snowball effect.
The consequence of this system backup isn't just the fact that we can't get to that next patient. It also affects whether or not the paramedic who's working is able to have a break. If it happens once in a while, someone doesn't get a break, it's not a big deal. But when every day you go to work and you don't get a break, not just a mental health consequence, but a physical health consequence as well. And then the social impact of this, which has always fascinated me, is that when a paramedic comes to work, there's a reasonable expectation that they get off on time. But where we're at in the system is if I expected to be home at 6 so I could go to my daughter's soccer game at 7, that may not happen. And once again, when we go from a rare occurrence to a regular occurrence, it affects family. So once again, it kind of comes back to this idea, when we think of the individual, we really have to be thinking of the broader context of family. And for paramedics, that's been a significant impact. Normally, no matter what kind of demonstration, there's usually kind of an understood positive relationship that the paramedics are there to help. And in this scenario, the emotion wasn't the same.
The protest arrives on Parliament Hill. The convoy starts to roll into Ottawa, tonight tracking the truckers and their supporters.
It wasn't necessarily antagonistic. There were a few flare-ups in terms of, politely I say inappropriate conduct, but it'd be racial slurs that were hurled at some paramedics, inappropriate behavior towards a paramedic crew trying to assist. And those negative events kind of cast a negative view on what was happening in many respects. And this isn't without any political view on what was or wasn't happening. It was strictly related to our service delivery. Right? Overall, it was a tough time, but when the decisions were made how to end this event, staff really did rise to that occasion, both in terms of kind of maintaining the impartiality throughout the front end of it. We're here to provide a service. And then dealing with the end in terms of supporting the police agencies, in terms of the removal, that is done safely. And, we had a significant role that really did kind of promote the public safety. Sorry to disappoint you. I haven't been able to start the program, but it's a great discussion piece because leadership sometimes is about the stretch, about trying something and seeing if you can get there. And sometimes you're not successful. I haven't given up, and I still think there's opportunity in this. Currently, we transport about 7 out of 10 patients that we go to. So we go to your house, 70% chance that we may take you to the hospital. In truth, that number could be 50%, because there's a lot of people who don't have to go to the hospital. Or there's people who go to the hospital don't necessarily need an ambulance to get them there. So we took a look at that and said, hey, are there occasions where we could hold that resource back for that next call for service? What stalled the process is the fact that there's a belief legally that if a paramedic arrives at your bedside, providing other than an ambulance to get you to the hospital is not permitted. So that's still in legal dispute. And I think those are items that can still be worked through. You know, the idea of this taxi service had a lot of traction. And why was that? It's partly because I think the community understands there's a real pressure in the system. I'm optimistic that we'll find some solutions along the way. And one of the solutions is right now that we have community paramedics that go and deal with patients in the community. On occasion, they provide a taxi voucher to individuals. So, the idea is that, like a lot of initiatives, you start with ones and twos and you build up from there. We talked a little bit about the pressures in the healthcare system, and there's incredible opportunity to promote change because doing the same is not the option. First and foremost, paramedics have to become true healthcare partners because I think we're part of the solution. Physicians used to do house calls. But today, it's the paramedic who's coming to your house. We are a resource that is still untapped. And there's so much more that we can do. In the last 10 years or so, the true evolution of the community paramedic has started to evolve. In places in Toronto, here in Ottawa, that somebody is a frequent caller of 911, why wait for the next call? Let's have somebody call them. How are you doing? How can I help you? What can I change so that you don't call us 10 times? It sounds so simple, but it's a beautiful thing. These are all opportunities to build system capacity, but also to make use of an incredible resource, which is the paramedic. And that's why I'm so excited about it, is that it isn't just one thing that we can do to change. There are many things.